still technique treatment for an exhaled rib, which starts first with making the diagnosis of an exhaled rib. So I'm placing my fingers along the aspect of the first rib here, getting as much contact of my fingers on the bone, pressing inferiorly to connect with bone is acceptable. Pressing medially would be considered choking and not advised. So, as I maintain that contact with the ribs, I'm going to ask my patient to take a breath in. And as he takes a breath in, you notice that this left side does not inhale. It does not move upward with inhalation. It remains downward and has a bit of motion as he exhales. So if we remember that a exhaled rib is down in front and up and back, that gives us a clue as to how we would set up this treatment. We're going to have the patient place his opposite hand on the table for support. We're going to place his hand here just temporarily. I'm going to place my index and middle fingers over that junction of first rib with the transverse process and the temporal or thoracic vertebra. I'm now going to move his arm backwards and then apply my vector force. The vector is going to come from his elbow to the rib head, not necessarily through the arm, shoulder, there directly from elbow to rib head. That compression should actually give you a sense of relaxation of those tissues. Because the first step of setting up a still technique is taking the tissues into a position of ease, I'm going to bring his arm upward, which mimics the up and back, down and front. I keep my compression there and then bring the arm up and around to complete the treatment. Of course, when one's done, you go back and reassess and take a breath in and out. And now the rib is moving nicely in both phases of inhalation and exhalation. And of course,